Okay. I'm now going to bring in Dr. Kurt Newman. Kurt, can you hear me?
Yes, I can, David. Thank you.
Okay. For those who may not be familiar with Kurt, Kurt is very actively involved in the Economic Club of Washington, for which we're very appreciative. But Kurt is also, as I mentioned earlier, the Chief Executive Officer and President of the Children's National Health System. He is a graduate of the University of North Carolina, and better than that, though, he got his medical degree from Duke University, and he's been a pediatric surgeon throughout his career. He started at Children's Hospital in 1984, I believe, and rose up to be the surgeon-in-chief, and then later the CEO, which is the position he's had since, I think, 2011. So, Kurt, can you tell us, now, where are you physically?
I'm here at the hospital in my office on Michigan Avenue in Washington, D.C.
Okay, so Children's National Hospital, how many beds do you have?
We're licensed for 323 beds. Sometimes we go higher than that when there's a lot of patients, but we generally run around 300 or so.
Okay, are your beds filled now with children or with non-children? Or are you taking non-children into the hospital?
We're our census is lower than normal right now. We're at about 200, 220, and this is a part of ramping down all of the elective surgery, anything we can put off so that we're ready for the surge. What we've done in terms of getting ready for the surge with the other hospitals in the region and with the leadership of our mayor and the governors is to accept and bring in all the children from all the other hospitals in the region, so that we can play that role, because we know that adults are more affected medically, and they'll need their resources for the adults. We also just raised our age limit during the course of this crisis to age 30, so we can take young adults and in that way contribute to the surge capacity in the region.
You wouldn't consider raising it to 70, would you?
For you, David, we'd raise it whatever it needs to be.
Okay. So, Kurt, let's talk about the cooperation among other hospitals. Are you guys working together well or not?
Yeah, it's incredible. We're lucky in this region to have just great medical centers and hospitals and terrific leaders. So almost every other day we're on the phone with each other. We're taking patients just this week from Georgetown, through a conversation with the CEO there, from MedStar, Johns Hopkins. Everybody's working together because we know that this is just such an incredible and unprecedented thing. There was no way we're going to get through it without that kind of collaboration and cooperation.
Now, why do you think it is that children seem to be less infected by COVID-19 than adults? What do you think is the reason?
Yeah, so it seems that they get infected and they can spread this virus, but they don't get the medical intensity as much as adults, and that's very unusual. Most viruses will hit young children and infants and adults, and that's where the severity is. And for some reason, with this one, children seem to be protected. And I think there's a lot of interest in why that is, and does that suggest some treatments, cures, or why are children protected? So I think that's going to come along. We're going to find out a lot of things as we get into more of the research capabilities here.
Now, you mentioned the surge. When do you expect the surge will occur in the Washington metropolitan area?
Well, there's different models, and you know, it's hard to get your handle completely on. And as it gets closer, you get more and more data, and it gets more and more accurate. From the best thing we can tell right now is we're thinking it's mid-May. Now, there's certain models that suggest that it may be later than that, and some models that suggest it may even be earlier, and we're already starting to see it. So it's a very confusing scenario right now to know exactly. What we're doing is preparing for the worst and hoping for the best.
Now, do you have enough supplies? Do you have enough ventilators? Do you have enough gowns, gloves, masks, so forth?
Yeah, this has been a very challenging thing, but it's just been wonderful to see how the community steps up, and we're starting to access a lot of different supplies. Our researchers, I got one here, they're using our 3D printer to create a face mask like this with engineers at the University of Maryland. So there's a lot of public-partner partnerships, but there are some things that we're short on, and it's been amazing. A lot of the economic club members, and I want to thank them, have been reaching out, sending meals over. We got a big load of hand sanitizer from one of the hotel chains here, from the CEO there. It's just been an amazing community thing. But right now we're in solid, really good shape with the respirators, everything that you need.
Is there anything that the business community can do to help you beyond what has already happened? Is there anything in particular that you need that you don't have yet?
Well, I think that there's a lot of ways to offer up help, and we certainly would love to, this idea of people sending things, meals over, or resources over to the hospital for our workers. It's just means so much. They're not only balancing a lot of stress and anxiety at home, but they're coming in and working on the front lines and you know, putting themselves in the way of maybe getting this infection themselves. We've had about 20 of our doctors, nurses, frontline staff test positive now, and so they're out on quarantine. Most of them are recovering beautifully, and that's the importance of testing too. We stood up 2 weeks ago with another great leader here, Pat McGuire over at Trinity University, a drive-through testing site, first in the nation for that, for children, and on her campus at Trinity. And it's been just terrific because we've been identifying these kids early. And they can be sources of spread. So that's although they don't get that sick usually, they can be sources of spread. So to identify it and keep them out of harm's way has been a major advance.
Now, are you involved a bit with the people working on the vaccine?
Well, you know, it's our research are starting to get that work going. One I'm really excited about, and this is sort of in the post-pandemic world, is that you had Jane Addams on from Johnson & Johnson, I think, last week.
Right.
With our research and innovation campus out at Walter Reed, Johnson & Johnson is one of our partners out there with J Labs, as well as BARDA, which is a big federal agency that just got $2 billion for vaccine research. So this post-pandemic world, we think we're really poised in this region to take advantage of that in terms of economic development with the NIH, the FDA, and really push that kind of science forward.
So what is your biggest worry right now?
My biggest worry right now is that that this surge is going to come hard, and that that the virus is going to, that some of our workers are going to get really sick. And we have 7,000 employees, and I'm just worried that they're going to get impacted like we've seen in New York and some of the places. So we're doing everything we can to protect them, to make sure that they're safe and healthy.
And obviously doing an interview, you don't wear a face mask, but are you wearing a face mask when you're not doing this interview?
Absolutely. We're on all across the hospital, everybody's wearing face masks, and you know, I wear it out into public. I was mowing my lawn last week with a face mask. You know, I think it's just good modeling because this is really what's going to flatten that curve. And I think, you know, I think we all as leaders need to promote the kind of behavior that's really right now the only thing that's truly protecting us.
Have you thought of hiring somebody to mow your lawn and you could work more on the healthcare problem, or you'd like the exercise?
David, it's not only the exercise, but it's kind of a Zen moment. I'm out there and it's just me and nature and a lawnmower. I mean, there's something about it for me that is really
now, as I go, from time to time I go out and I see a lot of people now wearing masks. Where are they getting these masks? How did people have them in their houses? How do all of a sudden people have all these masks?
What's amazing how many people had stocked up on masks at their home. I don't know, you know, if they were worried about some other situation happening, and we've had a lot of them sending these supplies to us. So, and people are making them too. We've got these just incredible folks that have companies, textile companies, and they're converting them over to making masks. And so there's just this whole kind of very interesting culture now of, we've got hundreds and hundreds of masks coming in of all different designs.
So what is your family doing? Is your family at home, and how is that working out?
Yeah, well, like Dina, our family is home. I have two boys. One was a senior in college. He's online, finishing up, and the other son is working, but working online. And we're together. I mean, that is a silver lining. We're all four of us are together, and it's just really kind of special in that way. But I also worry about the long term here, and particularly with children. How are they experiencing things, and how are they going to internalize this, and how are we going to think about this going forward? Because inevitably, and I'm really positive and optimistic, this is going to be over and get through it, but there are going to be some long-lasting consequences that we need to be mindful of.
So let me ask you a final question. The best way for people watching this to avoid getting COVID-19 is what?
Is to stay at home, wear a mask, wash your hands frequently, and really wait out and follow the leadership here in our region and nationally.
And contribute to the Children's National Hospital.
That would be a big one, but we've been around for 150 years. We're going to be here for another 150 more. This was going to be our birthday. We're just going to put it off a year, but there's a lot to look forward to.
Kurt, thank you very much for everything you're doing, and we very much appreciate your giving us this time. Thank you.
Thank you, David, and thanks to all the members of the Economic Club.
Thank you.